I'm Dr. Debra Hutchins. I'm a breast surgeon with Richmond Surgical at Henrico Doctors Hospital. I wanted to take a moment to discuss a national trend involving a drastically increased volume of women coming in requesting bilateral mastectomy. This really started when Angelina Jolie came out very publicly discussing her BRCA positive status. This is a mutation that greatly increased her risk of developing breast cancer during her lifetime. She subsequently underwent a bilateral total skin-sparing mastectomy with immediate reconstruction to very effectively decrease her lifetime risk of developing breast cancer. There's been an explosion of oncoplastic techniques to improve the cosmetic outcome of both the conservation patients and mastectomy patients. What is oncoplastic surgery? Essentially, oncoplastic surgery is a synergy of oncologic or cancer surgery with plastic surgery. We want the outcome to look as good as possible because the vast majority of our patients live out their lifespan without being affected or shortened by their breast cancer. Now, though it's very effective for prophylaxis and the techniques have improved substantially, it's a major procedure with a prolonged recovery and as high as a 20% risk of some form of complication developing during that reconstruction process. On the other hand, with the lumpectomy patients, it tends to be a 1-hour outpatient procedure with a very rapid recovery. You're often quite functional even the next day. What's most important is that the conservation patients have the same long-term survival as a mastectomy patient. If you ever find yourself among the 1 in 8 women in our country with a diagnosis of breast cancer, it's so important to sit down with your breast surgeon to discuss the specific characteristics of your history and tumor type, in addition to the risks and benefits of the various surgical options. Only after this involved discussion can you make a truly informed decision.